Good evening, everyone. This is a special night. It seems like Wednesday. I look forward to every Wednesday evenings where we've been doing these Airway Health Solutions conversations. My name is Lauren Gueits. I'm the host for tonight, and I welcome Dr. Scott Siegel. I am so thrilled to have you, Dr. Scott Siegel. Our journey has been quite the journey so far. So welcome. We have a lot to talk about today, and we have a lot of different guests with us in the field. But before we do that, I just want to, you have so many accolades here that we could spend the hour really going over all of your accomplishments and the tremendous contributions you've made to the field so far. So since this is a more conversational format, why don't you tell us just a little bit about your background and how you really got started on your incredible journey?
Sure. Thanks, Lauren. Thanks for hosting this. This is exciting. And yeah, my background, from an academic standpoint, I'm a physician and I'm a dentist. I'm an MD, DDS, what we call dual degree oral and maxillofacial surgeon. I'm double board certified. But my primary focus or my specialty is tethered oral tissues, which is a big term encompassing, what most people will know as lip ties, tongue ties, ties within the mouth. And my journey started 20 plus years ago. Actually, when I was in medical school, I happened to be mentored by a pediatric surgeon. Her name was Elizabeth Betty Carrillos. And she was a pioneer in the field and wound up developing a classification system that's used in infants called the Carrillos classification system. So she mentored me in school and my residency program. And then I had the privilege and honor of when I went into private practice in a group practice in Mineola, New York. She was the chief of pediatric surgery at that hospital at Winthrop. And her office was across the street from mine. And it just so happened that at that time, she was doing a lot of the infants and babies dealing with breastfeeding problems and using scissors for releases at the time. And I was using CO2, carbon dioxide lasers. And I was primarily using lasers for just general oral surgery, but a lot of facial, cosmetic and plastic surgery uses. And she asked me to start to use the laser on some of her babies that had these quote unquote difficult tongue ties that were posterior. I had no idea what that meant. And that's—
You didn't learn that in school, Dr. Siegel?
I didn't learn anything in school about this. And I always talk to, dentists and physicians and pediatricians and all of us in this field. We don't get any education in this area. And it's very frustrating. But that kind of kicked off my journey and the rabbit hole that became my whole life at this point. And it happens to a lot of us when we start going into this field. It kind of takes over. And, it's the ability to kind of cross over and meet so many amazing people in so many fields. And the collaboration that has, ensued, I think is just the biggest hallmark, and I'm sure we'll talk a lot more about collaboration, but
absolutely,
there's a big team approach here, and I just can't drive that home enough. But that's kind of what took me to where we are at this point.
Well, we're glad that you're here, and we talk about collaboration. We have social workers, neuropsychologists, chiropractors, lactation consultants, orofacial myologists, dentists, pediatric dentists, hygienists, speech pathologists, prosthodontists, orthodontists, dental assistants, and newborn care specialists with us this evening. So, I mean, that just warms my heart alone, just that we're collaborating and bringing the medical and dental together. And what better way for you to do it with your dual degree, to really kind of bridge that gap. So we really appreciate your knowledge and experience. But I also want to share kind of our journey together, right? Because I'm basically an airway hygienist. I did clinical work up until March 9th, actually. It was my husband's birthday. And working in Manhattan, you were right around the corner. So if I saw 8 patients a day, I probably wrote your referral script like 2 times a day, and had the consensus of the airway dentist, Dr. Andrew Reingold at the time, was very much on board, which really was, as you said, very important to bring them to you, right? At least for a consultation, just to learn more about that. And I couldn't believe how many patients I would see in a given day with this, with these conditions. So a lot of people may not even be aware of what TOT awareness is, tethered oral tissues. You just want to talk about that a little bit. I know we're going to show some pictures, but we're going to raise awareness, and some people listening may not even know what that is. So let's just start there.
Yeah, I mean, basically, TOT, or tethered oral tissues, or TOTS, is an acronym that was coined, I think, back in 2013 by pediatric dentist Kevin Boyd. It's been coined actually and used earlier by oral myofunctional therapists, Kimberly Benkert. And that's a big, broad, acronym, or all-encompassing, term to talk about tongue ties, lip ties, other restrictions inside the mouth, which can be in the cheeks. And we generally have 7 spots that we check for oral restrictions. It could be the upper lip, the cheeks on the upper, both sides, the lower lip, the lower cheeks, and the tongue. So that's TOTS awareness. And then we talk about how it affects, things in growth and development, and airway, breathing, sleep disorder breathing, dental growth and development. There's so many impacts that it's really tough to even talk about them all in an hour.
Right. I understand, but we're going to focus tonight on the adults' tongue ties specifically, because I really think there's a lack of awareness. Thankfully, there's an increased awareness to the infant tongue ties and tethered tissues. I know that from when I brought my son and was sitting in your waiting room. All the moms are there with their newborns, and I'm there with my 25-year-old, So I was definitely outnumbered. But yeah, so that'll be the focus for tonight, and perhaps we can have you back to really focus on infant and children tongue tie release, because again, we could be here for half a day, I'm sure. As a hygienist, I do want to encourage everyone in the dental field that the hygienist is a crucial role in this screening. It really starts with the oral cancer exam. It's really the same as the airway exam. So when I was doing my oral cancer screening, that's when I found all these tongue ties that I referred you to. So I do want to encourage the hygienists to really learn more about that, because not only can you save lives from oral cancer, but at the same time, you can really improve the quality of lives in your patients' breathing and overall well-being, as we'll find out. So when I came to visit you, I came because I noticed that all my family members had some type of tongue tie revision. I was out of clinical for a while, and then when I went back into clinical and saw them as patients on the Upper East Side, I had to bring them all to you. So tonight we're going to share that journey. We're actually going to follow my family members. We have videos of how Dr. Scott Siegel, how he does his exams, the conversations we have, some of the testimonials. So you can kind of see firsthand the journey from hygiene chair to the airway dentist confirming, then to the patient deciding. You want to talk a little bit about the importance of the airway dentist being on board in your experience?
Yeah, I mean, it's like you said, the hygienist, especially, you're in a unique position to see such a large number of patients. And many of these patients don't even spend much time with a dentist. They're seeing you to work on screening and education. And I can't tell you how many adult patients that have been picked up either by you or other hygienists from the dentist's office that, then when you bring that to the attention of the patient and then to the dentist when they come in, if it's an airway-centric dentist, which I think is a very important part of or piece of the puzzle in understanding the impacts of, the tongue ties or other areas of, the oral cavity and how it affects breathing and airway, it really can change the lives and actually potentially save lives. So I think, we've talked about this earlier, but you can count basically on one hand, or very, very few dentists out there who really kind of understand what we're talking about, and, raising this awareness about the airway and the importance of this.
Well, that's why we appreciate you being here to do that. So let's just talk a little bit about what a tongue tie is, because I know I also have patients tuned in tonight. So we're going to make this a very high level discussion.
Right. So basically, we'll keep this very simple, because it can get fairly complex in how we look at tongue ties and what is a tongue tie. In simple terms, a tongue tie is a restriction. We all have this thing called a frenulum, that little string, as we call it, underneath the tongue, or it could be underneath your lip as well. But for the tongue, we look at how long this is, where it's attaching, how much the person can elevate their tongue. There's other areas of movement that we look at, and we look at, how it's restricted. So if you go from the left, which, says normal, middle is moderate, the other one's severe. So you can kind of get a gauge. Many of us in the field, we don't even like to say mild, moderate, severe, or anything like that. We say they're present. It's like being mildly pregnant to somebody. Then we talk about function. We look at form, what's going on. We look at symptoms, and we kind of put all these pieces of the puzzle together. But that's kind of,
Well, it's nice just to have a visual aid for those who don't even understand what a tongue tie is. So I appreciate you taking it down a notch. And I found that I actually took this slide from your Greater New York presentation. I took a picture of it. I found this very helpful to talking about the fascia with patients because they had no idea, first of all, what the fascia is and how it's all connected. So why don't you tell us a little bit about the importance of the fascia and what it is?
Yeah, I mean, basically, we work very closely with what we call body workers, physical therapists, occupational therapists, chiropractors, craniosacral therapists, and if I'm leaving anybody out. But what we kind of realized over time of doing these releases for various reasons, a lot of our adult patients would say, wow, I feel looser. My whole body feels looser. I feel less neck tension. My head, it feels like it's more over my shoulders. My legs, my hip feel looser. And the physical therapy and OT research has shown, the connections between the tongue and the rest of the body with what we call fascia, which is a piece of connective tissue. It's kind of web-like collagen connective tissue that goes from the tongue and incrementally, you see on the slide, all the way down to the toes. And it's maybe not all one piece, but interconnecting little pieces, and the results can be amazing. I'm not going to get into too much detail here, but It's all connected.
Right, and that's just an important high-level concept. So when we think about that, I want to introduce you to our first patient, who's actually my husband. This is Eddie. He's 58 years old. It's rare to get a picture of him smiling, so I had to have myself in it also to show his teeth because he's a little self-conscious of it from the tetracycline staining. He's going to be a full case. But I realized, comprehensive care changes over time. So before I do the restoration, we have to do the expansion. Before we do the expansion, we have to have the tongue tie release. So in order to do it comprehensively, we needed to see you. And then he had these common symptoms that as hygienists, we can connect the dots also with the patient complaints, that stiff neck, that shoulder tightness, some anxiety, and even restless sleep. So do you want to talk a little bit about how these symptoms, you hear this so often with adults, and how it's related to tongue tie?
Yeah, I mean, for the most part, a lot of it stems back to, our airway and, maybe the tongue position, how it's affecting the airway and sleep disordered breathing. We tend to see a lot of people with, tongue ties as a marker for potential sleep disordered breathing. And when they're not sleeping well at night, there's a few things that happen. Number one, I'm not going to get into the great details about sleep and sleep restoration, but we see a lot of people coming in with heightened nervous systems. Their sympathetic nervous system, that fight or flight tone is elevated in people with these issues. They tend to be a little bit more anxious. They tend to be a little bit more, revved up on edge. The stiff neck, the shoulder tightness, we find as a compensation when a person has a tongue tie, potentially it keeps the tongue maybe a little further back and closing the airway off. And as a compensation, many of us will start to develop a more forward head posture. And that, sets forth all the compensations that you see, the stiff necks, the shoulder tightness, all of the way we carry ourselves. So these things are all connected that way.
Okay, so let's take a look and listen to actually Eddie and why he decided to go through with this tongue tie revision, because again, he's a little skittish. So how did I convince him as his hygienist and his wife? Let's hear from Eddie. So being Eddie's hygienist, I wanted him to get the revision. What finally made you decide that you should indeed get this tongue tie revision?
Well, I've always had trouble sleeping through the night. Usually get up 3 or 4 times during the night, and usually attributed that to just being, not comfortable or just fidgety. But, you know, in thinking about it even further, and then, you know, in following some of the things that Airway Health Solutions has been talking about, I started to realize that maybe there is a connection between my sleepless nights, some anxiety that I've had, and some stiffness in my neck. I've woken up with stiff necks a little more than probably the average person. So hopefully this procedure will lessen that, and I'll be able to sleep through the night, breathe a little bit better, and not have so many stiff necks.
Great, thanks.
Okay, so that brings us then to Dr. Siegel's office. So I thought people would want to see what it is you do when you first look at the mouth, and anything you want to preempt with this? You want me to just go ahead and play?
Yep, you can just go.
Okay.
Let me see you bite your teeth together first here. Okay, let's look at the dental arch. So yeah, he does have some narrowing here and some, you know, edge to edge or cross bite.
Yeah, this is, he's going to be a restorative case as well from the
As well.
tetracycline
Yep,
staining,
yep.
as well as the
Expansion.
bite. Correct. He's expanding.
All right, open big for me here. So what I'm going to ask you to do, with your mouth as wide open as you can, try to get the tip of your tongue up to the top of your teeth here. So you can see he's, you know, getting about halfway, maybe a little more up to the top or up to the teeth there. So I'm gonna ask you to close your teeth together and get your jaw or your tongue suctioned up to the top of your mouth. While it's suctioned, just try to open and maintain your suction up there. So open your mouth and keep your tongue up there. So we're only getting it there, and you have some pretty good control. You're able to hold it up there for, you know, probably at least 30 to 45 seconds. You know, it's a little bit of weakness, but it's pretty tight and restricted here. You can see that attaching onto the gums. The floor of mouth is elevating. He's recruiting a lot of neck muscles here too. So if you look more on the right side here, platysma.
Oh, yeah.
So if you look, just even to get your tongue up there, we're using a lot of muscles around the face and then the neck. And as soon as I basically I'm pushing down a little bit. Let me see you try to elevate your tongue a little bit. So it's painful. Sorry.
Sorry.
We're pushing against a lot of fascia and stuff like that. So, you know, just based on that, you're pretty restricted. The lip is a little tight here. Again, it's not anything that's a very obvious tight, but when I take my finger and I rub from side to side, it is a tight and restricted band. So a lot of times we'll think about, you know, just for periodontal reasons, as well as working on muscle function and whatnot, consider releasing that. But that's all I see at this point. So I would consider that a tongue, you know, ankylosing, technical term for tongue tie, and an upper.
Okay. Any comments on that, what you were feeling for, or just your experience?
I mean, you know, we're always looking to see, you know, elevation, restriction, and symptoms. You know, the thing that I really drive home is, you know, with these sorts of things, is dealing with a myofunctional therapist as a key component here. And I know that's part. We'll talk about that as part of the team. But having our patients prepared, you know, for the procedure, having done their adequate pre-op myofunctional therapy, and then continue that afterwards. But, you know, from a standpoint, he's a pretty obvious looking sort of tongue tie and lip tie there.
Okay, so I wanted to show here, remember how much tension Eddie had during when you asked him to raise his tongue? You could see that the veins pop up, the muscles work. This is during the release, but we're not going to show it because it's pretty graphic after the surgery was done. But I just want you to focus on this portion of the neck, how it's relaxed when he asks him to raise his tongue to the roof of the mouth.
Stick your tongue to the top there as best as we can. Open big. So before, when he was trying to get his tongue up to the roof of the mouth, he was recruiting all the neck muscles. And so that's released. And you don't see that tension, the bands of tension anymore.
So that was pretty remarkable. I mean, I was the one videotaping it, and that was so remarkable, where you can see all the overcompensation of those muscles. And then it was literally, it disappeared.
Yeah, I mean, that's one of the things that the majority of our patients will comment on, almost immediately, is that sense of, release. And it really is it's like a full body release.
Funny that you say that, because I have Eddie after 3 hours post-op. Let's see how Eddie feels.
So Eddie was the most tongue-tied of the family, and I just wanted to see how he's feeling about 3 hours after the procedure. So why don't you tell us a little bit about your experience?
Okay, I am very much skittish when it comes to pain. I have a low tolerance for pain. And so when I went, I was a little apprehensive, but they made me feel very comfortable. It wasn't really a painful procedure. It was a little bit painful for, I would say, about an hour and a half after the procedure, and it's calmed down a lot now. So I don't feel uncomfortable. See the work that was done, and I actually feel a little bit different now. So I'm hoping that that will continue, and I'll feel better each day that goes by. So I just want to let everybody know that it's not so painful. The pain passes, and we'll see where it goes from here.
So when you say you feel different, what feels different?
I feel a little bit different in my neck area. I feel like I'm a little bit more looser. I don't feel as tight, and I feel my mouth is a little bit looser and not so tight. So I know that it just happened 3 hours ago, so hopefully the effects of what has been done is going to be even realized even more over the next couple days.
Great. Any regrets?
No.
Terrific. Thank you.
Okay, so good answer, no regrets. And he's progressing nicely. It was only 2.5 months ago, so I'd like to show the afters when the cases are done, because we're all going through expansion. So that'll be a little bit more dramatic. So then the rest of my family, I actually had my son James, who's 25. He actually had a revision as well, but he's not featured on this chat tonight. But we have Devin, my daughter, who's 23, and Jack, 19. They both have that neck shoulder tightness. They both tend to be a mouth breather. Jack has a little bit more of the ADHD than Devin, and Devin has more of the digestive issues. So you want to touch a little bit about the ADHD and the digestion with adults?
Yeah, the ADHD thing, which has kind of come up, even in some of the AAPMD, seminars and whatnot, is we feel that a lot of the people with sleep disordered breathing, you're not sleeping well, you're not oxygenating well, and during the day, it kind of comes out as, potential attention or ADHD type of symptoms. Over the years, we saw a big uptick in the diagnosis of ADHD, especially in the children and as well as adults. And many of us in this field feel that it's, potentially due to sleep disordered breathing and how that manifests during the day. And you track that back, and it's like, well, maybe these people have tongue ties, and maybe that's a component there. So that's one piece of the puzzle that we look at. So, that component. Digestive issues, there's a few things we see with digestion. I always like to say when I'm lecturing about the digestion to either, adult dentists, physicians, or just in general, is that digestion starts in the mouth. So, is tongue tie the ability or inability to potentially chew your food the right way, masticate, how you swallow? Are you swallowing lots of air when you're eating? We see, which we call aerophagia, which you can see in kids and adults. Is it, the motility? Is there a motility disorder that starts in the mouth from the tongue tie all the way through? So there's a lot of questions, but we see it. We just see these things all the time. And we see a lot of people with quote unquote digestive issues, irritable bowel types of symptoms. Is this related to their nervous system? And things change after we do these releases, and we see a lot of our patients will report to us that things settle down. And we're just beginning here in the journey of understanding the science behind this, but these are things that we see.
What's your hope in, say, 5 years or 10 years even, everything's slow moving?
Well,
Where do
you
you
know,
see
we're
this
just working
going?
the getting the research, getting that moving forward. There's been a lot. There's been a lot going on in the past few years, in the past 2 or 3 years. Coming out from the Stanford group, Dr. Zaghi out in the West Coast has really been pushing a lot. Of us to really get this out and published, and trying to get valid, scientific research to kind of back up what we're doing. So I'm hoping in the next 5 years, the next 10 years, that it just keeps adding to,
Keep building the puzzle.
yeah.
Okay. So let's take a look and see Jack's visit. I just want to make sure that you'll be able to see the video. I'm going to go ahead and play it.
Tight up there at all to you at all? Because it feels okay, and it's pretty high attachment, so. And again, when you look at that, it's a little edge to edge, occlusion there too. So you open really big for us here. So open your mouth now. And we're gonna ask you, with your mouth wide open, try to get your tongue up behind your top teeth. So again, you see he's tongue tip up to behind the top teeth. About with your mouth as wide open as you can now. Try to get there. So maybe a little more than halfway. Now close your teeth together. Get your tongue up to the top of your mouth. Now open big. Get your tongue. Let's see you do your suction up to the roof of your mouth now. You get your tongue suctioned up there.
What does that mean?
Get your tongue, keep your tongue all the way sucked up to the top of your mouth and hold it up there. And open big while you're holding it. Good. Okay.
I'm looking for the clips.
Right.
She's already got
And stick your tongue out for us now. Let's say R. Good. Just look at your airway there. Good. So again, you see his tongue tie right here. Hurts when I lift it up, and you can actually, it's webbing onto his gums on the bottom there.
It's attached to the alveolar
Yeah, it is
ridge.
attached to the alveolar ridge. So I don't know if you can see it there, but it looks like the Eiffel Tower, as we call
Okay.
it. So Eiffel Tower appearing attachment there. So when we release it, we're looking to release all of that tension as well. Easy. All right. So I'm going to give you the gas. I'll tight up there at all.
Okay. All right. And then let's take a look at Devin, and then we can talk after about your recommendations and the procedure that you did itself. We're not going to show the procedure. Don't worry. I know people are a little squeamish, but we can do that on YouTube perhaps another time. But here's Devin's.
And again, she's recruiting some neck muscles to open and get your tongue up to the top. So, and you can see your little Invisalign buttons there. So let me see you close your teeth together. Beautiful teeth. Open as big as you can for us here. It's a little bit of scalloping of the tongue there. Stick your tongue straight out of your mouth for us here. Yeah, so she kind of pulls down a little bit right in this area as she sticks out. And when we try to kind of ask you to open up as big as you can and try to get your tip of your tongue up to the top of your mouth, so she really can't do that.
like a fish out of water.
Yep. And close your teeth together for us. It's a pretty flexible frenulum here, so I wouldn't even think about. And relax your lips. Her lip closure looks good, not much strain there at all. So it's more of a tongue, restriction issue. And well, hopefully you'll have fun with this too.
Yeah.
Okay, so we were a family of 5, and it's 5 for 5 that needed a revision. And you had decided, because I'm going through expansion, that it would be best to expand first and then do the revision. Do some pre-work with Brittany Sierra, my myofunctional therapist. Even though I was trained in orofacial myofunctional therapy, I certainly don't call myself a therapist. It's much more than a weekend course. So I look to go to the experts on that. But my common symptoms were really the daytime drowsiness, like getting really tired driving at 4 o'clock. I would literally be driving to a Met game and not even make it to Northern State Parkway. For anyone who's on Long Island, I would have to pull over because I just got really sleepy. So some people have been following me on my blog through this expansion journey. I have a 2-screw appliance, but such a crucial part of that was getting evaluated by you for the tongue tie revision. So let's take a look and see your evaluation, and then we'll talk about it.
Sorry.
All right, so open big for me here, Lauren. And I want you to now close your teeth together here. And open. Let me see you get your tongue to the top of your mouth. Good. So you actually, you know, when you watch how you get your tongue up to the top of your mouth, actually versus the others, you do have a little bit more weakness. Your tongue comes out. So you are restricted for sure. But you do have a higher arch, narrower palate. So in a case like that, you know, when we talk about expansion and you just started expanding, we'd probably want to get more towards the end of your expansion to make sure we have enough room for your tongue to fully fit up there. And the rest of your family had a little bit more space. So you'll benefit, you know, by doing the myofunctional therapy beforehand, expanding. We get to a point with monitor. Once we know you have enough room or space for your tongue, we do the release.
Great.
You'll get a better result. Less likely to reattach afterwards too. And that's basically it.
Okay, so that's where we left off on my journey. And I know we're here tonight, you know, to really talk about kind of putting all the pieces together. And I did have a couple of questions about what appliance I was using, and it's actually a 2-screw appliance. But maybe just elaborate a little bit more on your decision for having me wait to do the revision until after the expansion.
Yeah, and that comes up as debate all the time, you know.
Okay.
And it's like, you know, do we wait? Do you expand first? Do you do the release first? And we all go back and forth. You know, we did cone beams on you guys. And we're trying to figure out, you know, what is the best measurements to do. So there's no one right answer. A lot of it just comes down to experience. You know, when I see somebody and they don't have great tongue strength, they can't get their tongue fully suctioned up to the roof of the mouth, they're already in expansion. A lot of times I'll make the decision, and sometimes that's, you know, with you as a patient and with your whoever is doing. I don't do the appliances myself. So in the case like yours with Ben Moralia, we make the decision. Let's expand you first, get to that point where we know we're going to get you fully expanded to get that tongue up there and have a much better result. So I don't know if that answers that.
No, it does. There's no one right way. So it's really a matter of the patient and your experience. So this is what the appliances look like, because I had a couple questions on that. I'm in a 2-screw appliance for the upper, and then these are both removable for the lower. And I wanted to show you a case because I'm not completed yet. I'm on my journey. In fact, it should take me about 9 months. I just kidded with Dr. Siegel earlier that I just finished my first trimester, so to speak, with my expander. It's like giving birth to a new airway. It takes about 9 months if you're really compliant. So you can kind of see my progress for those who have been following me. You know, it's getting wider. So that's a really good sign. But let's take a look at a case that's a little bit more extreme than mine. This girl is actually Dr. Ben Moralia's case. And this was after she completed ortho. Okay, so this is the after treatment after 2 years of orthodontics. She had a tongue tie, and Dr. Moralia recommended she get the revision and then do the expansion. So this is the final part, and I'll kind of show you how we went through that to just tie this all together, no pun intended. But what a beautiful result that Dr. Moralia got just from using a 2-screw appliance followed by clear aligners. So this was a photo that was given by a previous doctor, her initial record when she was about 16. And you can see the transverse measurement here is about 27 millimeters. So with the expander, we were able to get about 7 millimeters of expansion with just the 2-screw appliance. So we will finish with the aligners to get even more. So she gets from 27 millimeters to 37, 10 millimeters of expansion. What do you feel about this amount of expansion? Let me show you to 37, but it's really amazing. This is showing you progress of 5 millimeters with the 2-screw appliance. I'm not quite there yet, so I'm looking forward to that. But you can see that we're really doing sutural expansion with these removable appliances. And then you can see with the results after the aligners, we had 10 millimeters of expansion. So it was a combination of palatal, 7 millimeters, and then just a little tipping, which is a wonderful result. We're increasing the oral capacity volume, and she was suffering so much from migraines and TMD, like debilitating. And she's basically a new person. I wish we could show her face, but for HIPAA reasons, we can't. But I'll go back to the smile. You can really see what a difference this treatment made for her. So what are your thoughts on this case, Dr. Siegel? And have you seen cases like this before, go the full gamut of expansion?
Yeah, I mean, we see it, and we love it when a patient's compliant, and, it's one of the big pieces of the puzzle here to help open up that airway. And again, it's another, amazing piece of the puzzle, especially for a removable appliance, to get a result like that.
Yeah, and I find that working from home is a little bit easier now post-COVID. A lot more people are working from home, so it's say more doable than perhaps the going into the office. So I find I was in aligners and also expanders. I tried both. I found it easier with the removable expanders, believe it or not, just for the compliance, because I like the break. You wear it, you take it out. With the aligners, I felt almost like I was in jail, 24/7.
Patients that we put in, the TAD types of, and they are not as well tolerated, I think.
Yeah, so this is a really non-invasive way to help your patients breathe better, sleep better, thrive better, remove a lot of the consequences of malocclusion. I am so excited that we have all of these different healthcare workers on and professionals, because we need a collaborative team in order to have an airway healthy patient. So it really starts with an airway hygienist, I'm going to say first, perhaps, to raise the awareness to the patients, and then the confirmation of the airway dentist. I had the pleasure of seeing in my family Dr. Stephen Park, who's wonderful, and he did the nasal scope, and we were all good in the nasal cavity, so we got the clearance there. Our next stop was to see you, and you were able to see our visit tonight. And then I'm working with oral facial myologist Brittany Sierra, who's on the Airway Health Solutions team. So for me, this is the dream team. And it would be great if you could have this team all over the country, if people started their own dream teams in their regions with collaboration. I know the DFW in Dallas, they have a great collaborative group. The AAPMD has great models to start a group like this. But in my opinion, this is where medicine and dentistry are blending together. And hopefully we'll see the patients are the ones who will truly benefit.
I couldn't agree more, as the AAPMD says, collaboration's yours, and it really does when you have this ability to blend, as you say.
Right, and a lot of people have trouble maybe finding an oral facial myologist or an ENT who's on board. So kudos to you and like Dr. Zaghi for this ongoing research. I know you're currently doing research at Columbia. That's exciting. So maybe we'll talk a little bit more about that at the end, because I want to make sure we get our questions raised, or I'll have you back and just focus on the infant tongue tie releases. But I couldn't do this process without the dream team, for sure. Everyone is equally as important.
Likewise.
So we need more airway dentists. Wouldn't you agree, Dr. Siegel?
100%.
I mean, you could probably count on one hand the airway dentists. We're in the same neck of the woods. We're both on Long Island, North Shore.
Realize, when you have dentists on every corner in the New York metro area, it's kind of shameful that you don't have as many as you really need.
And we like to help that at Airway Health Solutions. Dr. Ben Moralia, who I'm sure most of you on this call are familiar with, he's been doing this for the last 17 years, just focusing strictly on craniofacial development with kids and adults. So he's taken what he's learned, simplified it into a 2-day mini residency where you can teach and learn how to do this fairly quickly. He makes it so it's not intimidating. He has foolproof systems. And if you're interested, you can visit our website for more information. We actually have, I think, one opening left for this Friday, if anyone's interested, but we will have new courses throughout the year as well. And then if anyone wants to contact Dr. Scott Siegel, his offices in New York City and Huntington, Long Island, you can visit his website. It's a wonderful website. You are doing so much work, and your tremendous contributions to the field I can't even imagine how many people you've helped over your, what is it, 20 years you're specifically doing this?
Yeah, 20 years. I don't know, but it's so rewarding. I will tell you that.
I mean, did you think when you signed up for this that this is where you would be?
Nope. And it continues to change, and the fulfillment I get is just amazing. And that's what really keeps me young and motivated and happy and loving what I do.
Great. Well, it shows, and I love your passion. In fact, Dr. Siegel, he gives out his cell phone number to his patients, so not many doctors do that. You have a great empathy for your patients, which is really important. I know, especially with the moms who are struggling with breastfeeding, you take the time to listen, you take the time to educate. As you said, the procedures don't take that much time itself. It's in the education and the empathy and really creating value. So kudos to you for doing that.
Thank you.
So we have more upcoming conversations coming up next week. We actually have Dr. Ben Moralia back, and we'll be talking about expansion using clear aligners as an expansion tool. So that's always a fun, hot topic. So tune in. If you registered for this, I'll give you the links to sign in and to register, and you can receive the recording. And then December 2nd, our friend, Dr. Felix Liao, I recommend this book all the time to my patients, the author of 3 Foot Cage, 6 Foot Tiger. He has a new book coming out called License to Thrive. I was privileged to read the manuscript, and wow, what a wonderful book. So I'm looking forward to talking about that, and you can share that for yourselves and with your patients. I listened to your podcast this morning on my walk. It was a nice day today in New York. So I learned a lot about you, a lot of the research that you're doing. Just for time purposes, we don't really have time to go through all of those entities today. We just wanted to focus on one topic. But please listen to Brittany Sierra's podcast. It's I Spy with MyOI. And there's a whole segment with Dr. Scott Siegel talking about everything tethered oral tissues and the research that he's doing. So that was a wonderful interview. I want to do another announcement that our Collaboration Cures, as you mentioned, is right around the corner. So if you're not registered or if you're not familiar with the AAPMD, I highly encourage you to go to their website, check them out, because they're all about collaboration. Like an evening like this, where we have over 150 healthcare professionals uniting together to really learn more about interdisciplinary care as well as tongue ties. So it's really going to be a great event. And now it's time for questions. So I'm going to go ahead and stop my screen so everyone can see. And I'm going to start off with the questions that were asked during the registration, and then I'll head over to our chat. So someone just says, thanks for everything you do. I just wanted to share that with you. Jen Leppold in New Jersey. Is a release ever contraindicated in adult patients with sleep apnea? When and what do you do?
Right. So that's a big question. And I don't have specific answers, but we're trying to come up with, when do you not do it? And I'm not going to answer specifically at this point. We try to do cone beams on all of our patients. And reason being is we've had some patients where we've made matters worse. And so I'm not going to get into the protocols here, and Dr. Zaghi's working on those as well. But yeah, that's a real thing. So we're very, we kind of glossed over a lot in this, 45 minutes, 40 minutes. And it's just kind of because of the length of time and who we're lecturing to. But when we actually start to evaluate our patients, we get much more detailed and seeing who's going to really benefit from this.
Right. And also you can use this video. It's going to be on YouTube for patients who may be interested in learning more about tongue tie. We really wanted to use it as an educational tool for a first level. Let's see. Is this beneficial at any age?
I find it, the short answer is yes.
Okay.
And interestingly enough, but I see tons of infants. I had an almost 70-year-old woman patient yesterday, who came from a craniosacral or myofunctional therapist with breathing issues. And I see all types of people, from people with breathing issues, actors, actresses, who are trying to increase range of, their vocal performance and things like that. So yeah, again, the short answer is yes. Always.
Okay. How do you identify and treat posterior tongue tie? Do you use a diode or CO2 or scalpel?
I use primarily carbon dioxide laser, and I have transitioned from scalpels and scissors 20 plus years ago at this point. And how to diagnose a posterior tongue tie, that's a whole big lecture in of itself.
Yes.
um,
Okay. And are there any scenarios where a tongue tie is identified and a release would not be recommended?
Again, I think we, brushed upon that a little bit. If we think that is going to be the potential for worsening something as far as breathing or potentially obstructing the airway more. So we're talking in adults. I think that's the primary potential contraindication.
On release of tongue ties, is it common that previously trapped mandibles would make forward progress?
That's a good question. As far as what we do see, when we have our patients that are done with growth, if we're not expanding something, if you do a release, you could potentially get some forward movement, but you're still going to be limited by your joint and your TMJ and the ligaments there as well. We try to do it in younger individuals who are still growing to potentially get some benefit of more forward, growth of the mandible.
Okay, and when do we use myofunctional therapy versus surgery?
We try to use it in combination all the time. It's pretty much a given. It's not one or the other, but it's used in conjunct or in combination.
And that combination, another question was just the sequence of the combination.
So again, we're trying to get more science and data behind this, but we find that, having like a sandwiched approach where you do oral myofunctional therapy for a certain point before doing a surgical procedure, doing the surgery, and then continuing the functional oral myofunctional therapy after that. So that's kind of
So a very specific point. Do you have to have myofunctional therapy if you're an adult who gets a release?
You don't have to, but it is highly recommended.
Okay. Okay, and then let's go to our chat here. Someone likes your beard and thanks you for doing this. So that's nice, Stephanie Wagner. Someone wanted to know what type of expansion I was doing, so I explained that. And any special considerations when you treat adults versus children? There's a two-part question. Any contraindications with adults who have developed significant OSA?
Well, I think that we kind of brushed on that before.
Okay. Let's see. How common is it that patients experience a release of bodily tension?
I'd say that's one of the most common, I'd say comments that a lot of our patients will say. They feel that release.
And do you suture with the CO2?
Yes and no. In some instances, I leave it open. In some instances, I suture. Some of it is actually dependent upon the oral myofunctional therapist that I'm working with.
Okay.
I have many therapists who do not want me to suture, and they are really, capable of working their patients to make sure they get great range of motion. Then I have some where we're, potentially trying to guide the healing a little bit better, and I do suture. So again, there's no one right thing, one way I do it. I do fairly deep releases. I always have. And again, it's, tough to give you a percentage.
And then last question that we have, do you recommend body work before tongue tie releases if TMD and headaches are the primary symptoms?
Again, yeah, we would love to do that. We would love to incorporate all of these types of therapy in our patients. And I have many patients and I have the ability to, where I practice, I work with a lot of physical therapists, OT and chiros and whatever who deal with the body. And if we can do it, we do it. But it's not always feasible. And that's one of the issues that we deal with a lot of, the practical standpoints. Ideally, we would love to do body work or myofunctional therapy up front, do the procedure and continue that afterwards. And I think we will get better results that way.
Sorry, a couple questions coming in. Dr. Bender says, we find that adults are more uncomfortable afterwards than kids after release. Do you find that too?
Yes.
Okay.
Short answer.
Short answer. What is the ideal age for palate expansion? I'm curious in your opinion.
Well, I mean, ideal age is before your, sutures have closed and you're done growing. So childhood.
Okay. Well, those are all our questions. Is there anything you wanted to share with this audience of, collaborative workers on the research that you're doing? Any updates that we can look forward to as far as what, I know you're doing some work with Columbia. You
Yeah.
want to touch upon that? We have a few minutes.
We've kind of been halted with COVID for a little while as far as data collection.
Yeah.
But, from a sleep standpoint or a breathing standpoint, one of my studies that we're actually trying to get published right now deals with, kinematic, looking at tongue motion and whatnot. But for like tonight's purpose, one of the big things we're looking at is infant sleep before and after, tongue tie release. And we have some pretty promising objective data that's coming in at this point. So you say, yeah, this all starts as a baby. We're trying to treat end results and trying to deal with all of the issues that have happened in our adult patients that we're talking about tonight. But some of the exciting stuff is looking at, well, if we can get this across to maybe the pediatric or medical community, saying that, well, what we're doing here is helping prevent problems in adulthood with sleep disorder, breathing, sleep apnea, and all of these other health, areas. I think that's something exciting at this point.
Well, we certainly look forward to that. I have one more question, and this is my own question. What causes the tongue tie? Is it genetic? Is it acquired? What's the short answer for that, if there is
Short
one?
answer is that it happens in utero. Whether there is a genetic component, some of them do run in families. Some of them seem to come out of the blue, and there seems to be, but it happens in the first trimester in utero, and we're still not exactly sure why.
Okay. All right. Well, one more question because we do have a couple of minutes here. Do you get suture splitting with the palatal expander you are using? So I'm going to say yes, we do. Okay. We're going to post this to YouTube within the week, but I can also share this with you via a link so you can review. I know with some people asking how they can access this video. Anything else you want to add while you have everyone's attention? I know we covered our topic well tonight, I believe, and let's have you back for the pediatric component.
Right. I don't think so. I mean, it's a short, sweet thing that you can talk, for a month about.
I know, exactly. Well, that's why we wanted to keep it high level as an introductory. Hopefully this will help doctors show their patients, because I always felt it was a struggle to try to get my patients on board, and this will definitely help them with your advice and your experience. So thank you so much.
Thank you.
I am going to just leave it with your contact information on, in case anybody wanted to see how to get in touch with you one more time. Okay. There's my contact information. If anyone wanted to learn more about the appliances, we thank Kevin. He's always been a partner of ours. Kevin Ohlendorf. You can also reach out to Kevin about the specific appliances we mentioned tonight. So we'll end it with this, because this is why we do what we do. We picture success as really helping patients breathe, sleep, and thrive. So thank you, Dr. Siegel, for all the wonderful work and contributions you have.